Hello everyone, so we're just going to run through how to remove sutures. So for this procedure, you're going to set up your whole area as we did in the wound care both secondary and tenth. So you'll need a sterile field with all the things that you need, and when you're all ready, then you can then put on your sterile gloves. Some of the things you might need to include for this procedure is you need to include a stitch cutter itself. You want to you might want to have some forceps in order for you to be able to grip the sutures. You might need some steri strips in order to be able to cover the wound with them, and you might need a dressing to cover the wound after you've finished. Sometimes you do, sometimes you don't, it depends on the wound itself. So once you're fully prepared, you've taken the dressing off and you can see the wound, inspect the wound, and what we want to do is make sure that the wound edges look healthy, not red, not inflamed, and that they appear to be so the wound is healing nicely. You may at this stage want to clean the wound, and you can do that in whatever way is the most appropriate. For wounds with sutures, it can be slightly more difficult to use gauze to wipe the wound because obviously the sutures are in the way and it can be uncomfortable for the patient. So you may instead want to irrigate with a syringe or maybe with one of these saline ampules. Once the wound's cleaned and you're ready, what we want to do now is take the suture in our forceps, and we want to hold the suture by one of the tails that were left when the suture was made, and we want to lift the suture slightly out of the skin. Once we've got the suture slightly out of the skin, we're then going to cut with a stitch cutter the part of the suture that was in the skin and then pull the suture all the way out, so that the suture which goes through the skin and out the other side was never anything that was exposed to air, and hopefully that will reduce the risk of infection in the wound. When we're taking the sutures out, what we would strongly suggest, what is recommended, is that you take out alternate sutures. So just in case the wound hasn't adhered as best as it could, it won't suddenly spring open. You'll have some sort of tension there keeping the wound together. So do alternate sutures. Now this is just 3 sutures, so I would probably take out the middle suture and then the 2 either side. And that's what I'm going to do now. So what I'm going to do is I'm going to grip the suture. Now you can either do this with your forceps and lift it, or you can do it with your fingers, whatever's easiest. And being careful not to actually cut the patient. Just cut the suture with the stitch cutter and then pull the suture out. So lift the suture slightly out of the skin, cut the suture with the stitch cutter, and then pull it out. We've got those. Now I'm going to check the wound to make sure it's nice and stuck together, which it appears to be. Grip that suture, lift it slightly out, cut it, and then pull it out. Now I'm done, I need to make sure that I put this sharp in the sharp spin, directly into the sharp spin, and then I can treat the wound accordingly.